Welcome to this presentation on access to healthcare in rural Missouri by Kathleen Brunson, Catherine Bollinger Driver, Lauren Jones, and myself, Jamie Marcy. What will we cover? We're going to define what rural and lower socioeconomic status is and how it can affect a patient's health care. We'll explore what resources are available for patients to improve their health care. We'll talk about education that needs to be done with patients on self-care and what constitutes an emergency. And we will provide an overview of how telehealth visits can bring specialists to rural communities. What is the definition of a rural area in Missouri? Medicare sets the standards for what is defined as rural. Those guidelines are a non-urbanized area as defined by the U.S. Census Bureau, and currently designated within the last 4 years by the Health Resources and Service Administration as one of the following types of federally designated or certified shortage areas. Those are primary care geographic health profession shortage area, primary care population group health profession shortage area, medically underserved area, or governor designated and secretary certified shortage area. So they meet the rural designation. Now what? If an area meets that criteria, clinics in that area can be designated as a rural health clinic. What does that mean? That means better reimbursement for providers. That means more providers for the patient because of the requirement to have mid-level providers during at least 50% of the hours the clinic is open. And more providers means better access to medical care. So where do patients go when they don't have a provider? Sadly, these patients often go to the closest emergency room they can find, even when it's not a medical emergency. This can create a backlog of patients waiting to be seen. Some of those patients have time-sensitive conditions. So what is lower socioeconomic status? Webster's dictionary defines this as of, relating to, or involving a combination of social and economic factors. So, one could take from that lower socioeconomic means lower or the lowest financial and social support available in the population. So what does that mean? It means people don't have money for gas. It means people can't get to free resources. It means the specialists in the big city, they aren't accessible to them. And it means they don't have the knowledge to improve their health status, because with lower socioeconomic, a lot of times comes lower education levels and understanding levels. Transportation obstacles. Many insurance companies, including Missouri Medicaid, provide transportation for patients to appointments. I know there's also programs out there that will provide mileage reimbursement if they can't utilize the Medicaid transportation for whatever reason. County health departments are another great resource. They offer many services, including well child visits, vaccinations, and health education courses at free or reduced cost. Telemedicine. This is a growing field. Medical office groups around rural Missouri are setting up telemedicine suites. They're amazing. Not only do they have the video recorders available, so you can see your provider and the provider can see you, they have special stethoscopes that are connected to the equipment so that the physician can hear the heartbeat. The nurse will do the, that kind of the hands-on assessment part of them. The otoscope will look inside the ear for the physician. This is really cool. Community health fairs. A lot of your patients, especially older patients, don't go to the doctor just for screenings. They go to the doctor only when they're sick. So community health fairs are a great place for them to get diabetes screening, cholesterol screening, blood pressure checks, bone density scans, this kind of stuff. Critical access hospitals. These are your very small rural hospitals. Dent County has one, Salem Memorial District Hospital. It's an 8-room ER. They see a lot of clinic stuff, a lot of stuff that isn't emergencies, but with that comes a lot of your farming accidents, your STEMIs, your strokes, and these critical access hospitals get additional funding to educate the nurses on how to get that STEMI patient in and out in a certain amount of time to give them the best outcome. Community support. We also need to investigate community support opportunities such as Meals on Wheels, your church support stuff, outreach programs, support groups for cancer survivors, this kind of health insurance options. With the health insurance marketplace, we aren't supposed to have anyone who isn't insured. Many of your hospitals are going to have people on staff to help you figure out what your insurance options are, if you qualify for Missouri Medicaid. If you don't, let's find you a reasonably priced insurance to get you some. Listed here are a couple of resources specifically on the rural health clinics and critical access, and the reference list.